I believe most veterans lose their VA disability claims not because the VA doesn't care, not because they don't have evidence, but because their Nexus letters have failed them. And most veterans never realize it. They think a Nexus letter is just a note, something simple their doctor can scribble out in 5 minutes to say, yeah, this probably came from their service. But that's not a Nexus letter. That's just a missed opportunity. I can't tell you how many veterans come to me frustrated and confused, holding a denial in one hand and a short 2-sentence doctor note in the other. And they'll say, I don't get it. My doctor said it was related to service. Why did the VA still deny me? And when I look at the note, I see the problem right away. It's missing the language, the structure, and the medical reasoning the VA needs to legally connect the dots. Here's the truth most veterans don't know. A Nexus letter isn't just another piece of paperwork. It's the keystone to your claim oftentimes, the document that bridges the gap between your diagnosis and your time in uniform. Without it, the VA has no roadmap to follow sometimes. Most veterans never get taught that. Instead, they're told, just get any doctor to write a letter, or they go online and find a $50 template, plug in their name, and hope for the best. And then they wait for months, only to open the brown envelope that says not service connected. Does this sound familiar? That's not because the VA ignored you. It's because the letter didn't speak their language. If you see, not all Nexus letters are created equal. A weak Nexus can sink a strong claim, but a properly written, medically reasoned, and legally structured Nexus letter can single-handedly win one. Think of it like this. Your service records are the foundation. Your medical evidence is the framework, but the Nexus letter, that's the blueprint that tells the VA how everything connects. And if the blueprint's wrong, the whole structure collapses, even if the materials were good. The pros? Accredited agents, medical experts, and seasoned advocates know this. They treat Nexus letters like a surgical tool, precise, targeted, and designed for maximum impact. They understand the right words. It is at least as likely as not, backed by solid reasoning and evidence that can turn doubt into documentation and confusion into clarity. And that's what I want to teach you today. Because once you understand what a Nexus letter is, how it works, why it fails, and how to make it bulletproof, you'll never waste another dollar or another denial letter on bad advice again. So if you've ever been told you need a Nexus letter, but no one actually explained what that means, this is the episode that'll finally make it clear. By the end of today, you'll know exactly what separates a weak Nexus letter from a winning one, and how to make sure your Nexus letter doesn't just check a box, but actually changes your outcome. So let's get real. A Nexus letter is not just a formality. It's definitely not just another piece of paper. It's the medical and legal bridge between your diagnosis and your service. The one document that can literally determine whether your claim gets approved or denied. Think of your VA claim like a court case. You're the plaintiff. Your service records are the evidence, and your Nexus letter is your expert witness, the professional testimony that says, yes, this condition is at least as likely as not caused or aggravated by military service. Without that testimony, without that bridge, your evidence is just a scattered pile of papers that the VA has no obligation to connect. A doctor's visit here, a prescription refill there, maybe a note from a buddy over there who saw you hurt in training, but no one tying it all together in the way the VA can act on. And here's what most veterans don't realize. The VA is not designed to interpret your evidence for you. They're not going to play detective. If you give them 10 pages of medical notes and expect them to piece together the cause, the timeline, and the connection, you're going to end up with a denial letter that says insufficient evidence of service connection. That's not because the VA hates you, it's because they can only rule on what's clearly presented. They need the dots connected in the language they're trained to understand. Clinical, evidence-based, and specific. That's why your Nexus letter matters so much. It's not just saying this is related to service, it's about showing the logic, the medical reasoning that leads the VA to that conclusion. If your Nexus letter is vague, incomplete, or written by someone who doesn't understand the VA standards, it's like handing the VA puzzle with half the pieces missing, and then getting mad when they can't finish it. So here's an example. A veteran might submit a Nexus letter that says, it's possible his back pain is from military service. That's too weak. The VA can't approve a claim based on possible. But if that same Nexus letter says it is at least as likely as not that his chronic lumbar strain is due to repeated rucksack carrying and documented in-service back complaints, suddenly the VA has everything it needs. Probability, medical reasoning, and documentation. When you understand what makes a Nexus letter strong and when to use it strategically, you stop throwing paperwork at the VA hoping something sticks and you start submitting proof. That's the difference between veterans who stay stuck in appeals for years and veterans who get approved on the first try through. It's not luck, it's strategy. Here's what happens when you don't get this right. You'll open that brown envelope one afternoon, hands shaking a little because you've been waiting for months. And instead of seeing granted, the first words you read are not service connected. Your heart sinks. You flip through page after page, scanning for the reason, and it feels like the VA just looked at your story and said, "We don't believe you." You sit there thinking, "But I proved it. I sent them everything, my records, my doctor's notes, my service history," and you did, at least from your perspective. But here's the hard truth. In the VA's world, proving it means speaking their language, the right phrasing, the right format, and the right medical reasoning that ties it all together. If your Nexus letter doesn't do that, if it's missing that one crucial connection, then to them, your file isn't complete. I've seen this more times than I can count. Veterans with slacks of evidence get denied, not because their injuries aren't real, but because their Nexus letter was written vaguely or lacked rationale or skipped key phrases like "at least as likely as not." And that single oversight can cost you years, years of appeals, years of waiting, years of living with untreated conditions while you still fight a system that could have said yes the first time. But when you get it right, when your Nexus letter checks every box, when it uses clear evidence-based reasoning and VA-approved language, everything can change. It gives the rater exactly what they need to connect the dots between your diagnosis and your service for. It takes a pile of medical records that once looked random and turns them into a cohesive, undeniable story. I've seen veterans go from 0% to 70% on a single claim. I've seen others win full service connection after years of denials, not because their condition got worse, but because their evidence got smarter. That's what's at stake here. One letter, written correctly by the right provider using the right reasoning, can be the difference between years of frustration and the recognition and compensation you earned decades ago. You've already paid the price in service. You shouldn't have to keep paying it in paperwork. Let me tell you about a veteran named Marcus. Marcus served 11 years as an Army infantryman. He had multiple deployments in combat zones. He was the kind of soldier who carried the heavy ruck, who volunteered for tough assignments, who never complained no matter what his body was going through. By the time he came home, his knees were wrecked. He had migraines that hit him like flashbangs and back pain that had made it harder to sleep than a couple hours at a time. Like so many veterans, he didn't make a big deal about it. He just figured it's part of getting older. It's part of the job. But when the pain got bad enough that it was interfering with work, he finally decided to file a VA disability claim. He did it the way most veterans do, with good intentions, but not a lot of guidance. He gathered his service records, a few doctor notes, and even convinced his primary care doctor to write him a short letter saying his knee pain was possibly related to military service. A few months later, he got the brown envelope, denied. Reason: insufficient medical evidence to establish medical connection. Marcus was frustrated, but he didn't quit. He refiled, added a few more notes, and waited again. Denied again. When he came to me, I could see it in his face, that mix of frustration and resignation that so many veterans feel after years of being told no. He sat across the desk from me and said, "I've got the records, I've got the x-rays, what else do they want?" So we pulled out his file. The problem jumped out immediately. It was his Nexus letter, the very piece of evidence meant to connect his condition to his service. But it contained the sentence, "It's possible his knee condition is related to his service." That one word, possible, had tanked the entire claim. See, the VA doesn't work in maybes or guesses. They work in probabilities. When a doctor says possible, the VA hears unproven. That single word erased everything else Marcus had submitted. Years of medical documentation, imaging, and service records, all because the letter didn't meet the VA's evidentiary standard. So we started over. We connected Marcus with an orthopedic specialist who understood both medicine and the VA process. The doctor reviewed his imaging, his deployment history, and his service treatment records. He noted patterns of chronic knee complaints from training logs, wear patterns consistent with heavy load bearing, and an MRI showing degenerative joint disease that had clearly developed over years. Not overnight. This time, the Nexus letter was precise and evidence-based. It read, "It is at least as likely as not that the veteran's chronic knee osteoarthritis began during his period of active duty service as evidenced by consistent knee pain, documentation, and physical strain consistent with infantry training." That one paragraph did what years of submissions couldn't. We resubmitted the claim with that Nexus letter. 90 days later, approved. The difference wasn't new evidence, it wasn't luck, it was precision. The first Nexus letter told a story of uncertainty, the second one told a story of connection, logic, and proof. Marcus went from being told not service connected to finally hearing the words he'd been waiting for years. Service connection established. And when he got that call, he didn't talk about the money. He said, "I finally feel like they believe me." That's the power of a well-written Nexus letter. It's not just about ratings or compensation. It's about validation. It's about finally having the system acknowledge what you already knew, that your service came with a cost, and that cost deserves to be recognized. So when I tell veterans the difference between a myth nexus and a pro nexus, this is exactly what I mean. A myth nexus says maybe, a pro nexus says here's why. And that difference can change everything. So here's some teaching advice about the 3 things pros know about Nexus letters. 1, a Nexus letter is a legal document, not just a medical opinion. It's the very first thing every professional in this field knows. A Nexus letter isn't casual correspondence between you and the doctor. It's a medical legal statement that carries weight in a federal benefits system. Every single word matters. The VA doesn't evaluate your Nexus letter like a doctor would. They evaluate it like a piece of evidence in a legal case. They use something called the probative value standard, which basically means how strong and credible is this opinion. They look at the clarity of the language, the evidence used to support it, and the reasoning behind the conclusion. If your provider writes something like, the veteran's back pain may be related to military service, that statement carries almost 0 probative value. The VA hears may and translate it to speculative. And under VA law, speculation doesn't win claims. Think of it this way. The Nexus letter is your doctor's expert testimony in a courtroom. Would you want your lawyer saying, maybe my client is innocent? Of course not. You want them saying, it is at least as likely as not my client didn't commit the crime. Same principle. The VA operates on probabilities, not possibilities. That's why professional level Nexus letters use very specific, legally recognized phrasing, not guesswork. It's calibrated to meet the VA's evidentiary threshold. The golden phrase, the one the VA actually trains its raters to look for is, it is at least as likely as not, which means 50% or greater probability that this condition was caused or aggravated by military service. That single sentence tells the VA this opinion meets the legal standard for service connection. So go do this right now. Before your provider writes your Nexus letter, tell them exactly what the VA needs. Print that sentence on a sticky note if you have to. It ensures your provider's opinion doesn't get downgraded or dismissed for lack of clarity. Because you can have the most compassionate doctor in the world, but if the Nexus letter doesn't use the right legal language, the VA is legally allowed to disregard it. A strong Nexus isn't about emotion, it's about precision, and precision wins cases. Number 2, who writes it matters less than how it's written. The next big thing the pros know is this. It's not about the title, it's about the detail. You could have a Nexus letter from a world-renowned surgeon, but if it's vague or lacks medical reasoning, it's essentially worthless. On the other hand, a detailed, well-supported Nexus letter from a nurse practitioner who knows your history can be incredibly powerful. Now, specialists do carry extra weight in certain cases. A psychiatrist for PTSD, a neurologist for migraines, orthopedist for knee or back conditions. But what matters most is that whoever writes it understands your service history and provides medical reasoning that connects all the dots. That's where most Nexus letters fail. Doctors will often write a one-liner like, veteran has chronic knee pain likely related to years in the infantry. That might make sense to you and me, but to the VA, it's missing 3 key ingredients: proof, context, and continuity. A professional Nexus letter should reference 3 core categories of evidence: objective findings, things like imaging, x-rays, MRIs, CT scans, lab results, or clinical test data. These are facts, not opinions. They give the medical opinion weight. You need service events. The doctor should identify when and how the condition likely began. For example, symptoms first documented during deployment in 2007 following repeated exposure to IED blast. The VA needs to see a link to service events, not just assumptions. And 3, you need to have chronological continuity. This shows the condition didn't just appear out of nowhere after service. It's a consistent, ongoing problem that began in uniform and continues today. For example, the veteran's medical record demonstrates progressive worsening of lower back pain since the initial complaint recorded in 2004. That's how you turn opinion into evidence. It's not about how many credentials the provider has after his name. It's about how well they explain the why behind their opinion. So here's a pro insight. If your medical provider doesn't have experience writing Nexus letters, don't panic. You can help them. Bring them examples or a checklist. Tell them what the VA looks for and why it matters. When doctors understand that this isn't just a note from your chart, it's a legal document for your claim, they'll approach it a little differently. And that's what we do at Xterra Health. We write Nexus letters that meet both medical and VA evidentiary standards because clarity beats title, structure beats prestige every single time. Number 3, you gotta have a strong Nexus letter that follows a formula. Here's the part that separates the amateurs from the pros. Every strong Nexus letter follows this formula. It's not guesswork. It's not creative writing. It's a structured, evidence-based format that answers the exact questions the VA rater is trained to ask. Think of it like this. If you were building a house, you wouldn't start by guessing where the foundation should go. You'd use blueprints. A professional Nexus Letter is that blueprint for your claim. When pros write them, they all follow a proven 4-part structure. 1 is the diagnosis. They name the condition clearly and clinically. It sounds simple, but you'd be surprised how many Nexus Letters skip this step. The first thing the VA looks for is, what is the diagnosed condition and is it recognized by medical standards? A good Nexus starts with precision. For example, the veteran has been diagnosed with lumbar degenerative disc disease confirmed by MRI performed on February 15, 2023. They are not looking for the veteran has back problems. See that difference? It's small, but to a VA rater, it's everything. Specific diagnoses tied directly to VA diagnostic codes, which determine eligibility and percentage ratings. If your Nexus doesn't include that level of precision, you're leaving points and credibility on the table. Next, you've got to have a service connection statement, the at least as likely as not standard. This is the legal backbone of the entire Nexus Letter. It's the part that directly answers the VA's most important question. Is it at least as likely as not that this condition was caused by or aggravated by the military? Those 7 words, at least as likely as not, carry massive legal weight. It means the doctor is stating there's a 50% or greater probability that your service caused or worsened your condition. That's the threshold the VA must meet to approve service connection. If the Nexus Letter uses soft language like possibly or could be, the VA will interpret it as insufficient evidence. But if your letter includes, it is at least as likely as not that the veteran's left shoulder was caused by repetitive heavy lifting during military service, the VA legally can't dismiss it as speculation. They have to weigh it as probative medical evidence. So here's a pro tip. If your provider hesitates to use that language because it sounds too strong, explain that it's not a promise, it's a probability standard. It doesn't mean they're guaranteeing causation. It means they're stating professional medical judgment within accepted VA thresholds. Next is the rationale, the why that proves the connection. This is where most letters fail and where the best ones shine. The rationale section is the doctor's medical reasoning. It explains why they believe your condition is service connected. Without it, even the strongest statement loses credibility. A weak Nexus Letter says, it is at least as likely as not that the veteran's knee condition is related to military service. That's technically correct, but it lacks proof. A strong Nexus Letter statement says, it is at least as likely as not that the veteran's bilateral knee osteoarthritis is related to military service, as evidenced by consistent documentation of knee pain and in-service treatment records from 2008 to 2011. Multiple episodes of field training with load bearing exceeding 80 pounds and imaging findings showing chronic degenerative changes consistent with long-term mechanical strain. Do you see the difference? The second example connects the dots between the service history, medical records, and current evidence. That's the kind of medical rationale that wins cases. Go do this right now. If you're meeting with your medical provider, help them help you. Bring copies of your service record that document injuries, physical profiles, or duty limitations. Show them your current imaging or specialist notes. Ask them to connect the before, during, and after. That's what the VA needs to see. Next is the signature and credentials, the proof of authority. This might seem like a small detail, but it's huge for credibility. The VA weighs opinions differently based on the provider's qualifications. A Nexus Letter that ends with Dr. John Smith, MD, orthopedic surgeon, license number XYZ, contact XYZ, carries far more weight than a signature that just says Dr. Smith. Always make sure your medical provider includes full name and title, medical specialty, state license number, date of the letter, and contact information. If your Nexus Letter is ever challenged or verified, the VA can contact that medical provider directly to confirm its authenticity. And that level of transparency only strengthens your case. So pro tip, the VA isn't grading your provider's grammar or writing style. They're grading the structure and logic of the medical reasoning. A clean, professional Nexus Letter that follows this 4-step formula will outperform a 10-page emotional letter every single time. The best Nexus Letters don't rely on emotion, they rely on clarity. They tell a story of cause and effect, written in the VA's language. That's why the pros, the accredited agents, the medical experts, the legal advocates, all follow the same formula. Because when you do, you're not submitting a request, you're submitting proof. If you're watching this and realizing your Nexus Letter might be weak, or you've already been denied because of one, don't start over, don't give up, don't guess. You don't need to reinvent the wheel. You just need to fix what's broken. And that's exactly what we do. So head over to XterraHealth.com and schedule your free medical record review. We'll go through your existing Nexus Letter line by line. the language, the structure, the medical reasoning, and show you exactly where it went wrong and how to make it strong. If you don't have one yet, we'll help you build it from the ground up. Written by licensed physicians who understand VA standards, medical evidence, and the language that turns a claim from maybe into approved. Because this isn't about templates or magical phrases. It's about strategy and precision. When your Nexus letter is written correctly, you don't have to plead with the VA. You simply present the truth in a format they can't ignore. Drop the word Nexus in the comments below, and I'll personally send you a free Nexus letter checklist. It walks you through what to include, what to avoid, and the exact VA language your provider should be using. You can even bring it straight to your doctor so they can see it firsthand and see what makes a Nexus letter credible in the eyes of the VA. Stop letting weak evidence hold back a strong claim. Stop hoping for approval. Start proving it. Because when your Nexus letter speaks the VA's language, you're not asking for permission anymore. You're asserting your right to the benefits you earned. You served your country. Now it's time for the systems to serve you. Now, in the next episode of Mission Ready, we're stepping back from the paperwork and exposing one of the biggest problems facing veterans today, the VA disability backlog. I know it's horrifying, and we're going to talk about why. We're talking about the millions of claims sitting in limbo right now, the endless delays, the buried files, and the outdated systems that are leaving veterans waiting months or even years for decisions. I'll walk you through what's really happening behind the scenes, why claims are taking longer than ever, how the VA's modernization efforts actually made things worse, and most importantly, what you can do to make sure your claim doesn't get lost in the backlog. If you've ever wondered why it takes the VA 6 months or a year to do something that should take 6 weeks, you don't want to miss this one. So hit subscribe, turn on notifications, and share this with a veteran buddy who's still waiting for a decision letter that should have come months ago. Because the only way we can fix the system is by understanding it and demanding better. And as always, stay strong, stay sharp, and stay mission ready.